On February 25th, the U.S. House of Representatives approved a budget framework that calls for $4.5 trillion in tax cuts, $2 trillion in spending cuts, and increases the debt limit by $4 trillion. House Democrats warn Medicaid will have to be fundamentally changed to cut spending at that level. But please note, no benefits have been cut at this time. The budget conversation is still continuing. House Speaker Mike Johnson, before the vote, persuaded several Republican lawmakers to support the bill, including those Republicans who were initially hesitant to do so because of the threats to Medicaid. The bill passed almost entirely along party lines, with Republican Tom Massey out of Kentucky being the only Republican to vote no. In this budget plan, Medicaid is threatened. The House budget resolution requires $880 billion in spending to be cut over 10 years, specifically from the House Energy and Commerce Committee. That's the committee that has jurisdiction over Medicaid. The process being used here is called budget reconciliation, and that means Republicans will have to find all of the $880 billion in cuts solely from within the Energy and Commerce Committee's jurisdiction. That leaves House Republicans with very few options. Experts say Congress can find some cuts or savings from programs other than Medicaid, like Medicare, the Children's Health Insurance Program, or some budget savings from cutting certain tax credits or increasing the gas tax. But even with those other cuts, they would still be hundreds of billions of dollars short of that $880 billion number. Health policy experts say this version of the House budget means major cuts to Medicaid, Medicare, or both. The chair of the House Budget Committee, Representative Arrington out of Texas, celebrated the budget vote and said everybody had to make some sacrifice or have some pain involved. Where we've been, this plan first came out of the House Budget Committee on February 13th, and the Senate passed their own budget framework on February 21st. President Trump said he endorsed the House version of the budget bill. But coming up, the Senate does have to come to some consensus with the House. They both have to pass identical budget plans. Then both houses of Congress will need to write and pass legislation that follows its instructions, and the budget reconciliation process means Republicans can pass tax cuts without the support of Democrats blocking a Senate filibuster. Experts urge the House and Senate to reject this House budget plan and instead defend health and well-being of millions of people. Elizabeth Taylor of the National Health Law Program said millions of low-income families, children, people with disabilities, and older adults depend on Medicaid for life-saving care. And she says slashing its funding would devastate public health, deepen health disparities, force hospital closures, and drive more people into medical and financial crisis. You can read that House budget resolution. We link to it in the description below.